advantages of the forceps and very special uses is this instrument. This is the assistance instrument. Now normally the assistant will put the cement in the crown, or the dentist will put the cement in the crown and to get ready for cementation. Also normally they would very much like to put Vaseline around the outside of the crown so that any overflowing cement does not stick to the crown. This is very important because this is a very laborious process to remove it. So normally the assistant and the doctor are wearing gloves, and when the cement is put in the crown, the assistant then puts the crown in their hand like this, with the cement side up. The dentist will then, pick up the crown from the assistant with his non-dominant hand and position it in his dominant hand ready for cementation. By that time, cement is already getting on the gloves, okay? And because the gloves are in skin, there's a little bit of slop in the gloves also. The gloves are not skin tight. Then the dentist approaches the mouth and puts the crown on the tooth. A lot of things can happen between picking the crown up, transferring it to the hand, and positioning it to the patient. Normally, the initial set time is somewhere around 45 seconds to a minute. If something happens whereby the dentist fumbles or the crown is dropped, which can happen because sometimes the gloves are wet or sometimes it's not skin tight, he drops it. If the initial set has already started before that crown is in the patient, the dentist then has to wait for the crown to completely set, which could be 5 minutes. Then he will have to drill out the cement. If it has fallen, he'll have to sterilize it, and he's already wasted an hour of chair time. Here, this forceps is the assistance instrument, and with the use of this instrument, nobody, neither the dentist nor the assistant, ever has to touch a crown again during cementation. Also, with the use of this instrument, Vaseline can now be placed around the outside of the tooth without the fear of having it slip out. The forceps works by a reflex back, and the reflex back comes from these springs. You adjust the forceps to be 1/2 to 2/3 the buccolingual diameter of the crown, spread it apart, and gently have it comfortably rest on the crown. Now there are carbide inserts in this, but it's non-injurious to the crown, to the porcelain, or to gold. Grasp the crown like this. Now the assistant can put cement in the crown and hand it to the dentist. The dentist takes the crown, or takes the instrument, and holds the thumb and index finger on one side and uses these fingers to separate it. You do not squeeze to separate it. It's a reverse action. And this way, there is an infinite positioning of the crown in the forceps. So now the dentist approaches the patient just like this, puts the crown on the abutment and gently separates, and once the cement has touched the abutment, it stabilizes, almost like a glue. And then the dentist separates the blades and completes the insertion by using a mallet and a green stick, or finger pressure, or having the patient bite down. And this is also after all of the contact points have been satisfied and the bite has been satisfied and the tooth is ready to be cemented. Now that's this forceps.